morning, ladies and gentlemen, and welcome to a very special session at the World Health E-expo 2020. The COVID-19 pandemic has placed the in vitro diagnostics industry at center stage for the first time. Acting on these developments, the Associated Chambers of Commerce and Industry of India, ASSOCHAM, and the Association of Diagnostics Manufacturers of India, ADMI, have organized deliberations on the IVD sector over 2 days. The session this afternoon aims to discuss the strengths, the shortcomings, and the opportunities related to the IVD market in India. The primary aim of the panel is to deliberate upon the question, why is India less than 2% of the global IVD market, and what are the missing links? My name is Veena, and I'm the president of ADMI and the CEO of Vanguard Diagnostics. Joining me today is Mr. Abhinav Thakur, Secretary ADMI and Managing Director, Accurex Biomedicals. We feel extremely honored and privileged to be moderating this distinguished panel composed of senior officials from the Government of India and leaders from the IVD industry, both from India and overseas. In recent times, India has shown itself to be agile, nimble, and tenacious, quickly ramping up the medical and healthcare infrastructure of the country in response to the COVID crisis. India has launched a host of medical research initiatives for diagnostics, treatment options for the virus, and development of vaccines. The crisis indeed comes with a silver lining. It has presented a unique opportunity to position India as a global manufacturing hub. So what will it take to make India a significant contributor to the global diagnostics ecosystem? Indians are a significant 18% of the world population. However, India's share in the global IVD market is less than 2%. The global IVD market in 2019 was pegged at $65 billion, with India contributing only $1 billion to this number, thereby making up a meager 1.5% share. The Indian IVD market has been growing at a CAGR of 15% against the global average growth rate of about 5% during the past 10 years, and yet it has not been able to cross the 2% share mark, which itself appears insignificant. So what are the reasons behind these numbers? Technology appears to be one of them, as it seems to have a direct relationship with market size. More than 80% of the world's IVD market is held by 3 technology-rich geographies: USA, Europe, and Japan. Additionally, innovation, quality, and manufacturing capacities, alongside awareness, domestic demand, and supportive government policies are considered to be crucial cogs of the wheel in a growing and increasingly robust market. Therefore, the questions that lie in front of us include: what are the missing links to making India a significant contributor to the global IVD market? How can we create a complete chain of capabilities to increase India's share in the world market? And how can government policies accelerate this process? Today, we will aim to analyze in depth and hopefully answer some of these questions in the company of what is undoubtedly an exceptional lineup of panelists. Our first guest today is Dr. Vipul Agarwal, Deputy Chief Executive Officer, National Health Authority, Government of India, and the Deputy CEO, Ayushman Bharat. Dr. Agarwal is a serving IPS officer and a gold medalist in forensic medicine from Maulana Azad Medical College, New Delhi. Ladies and gentlemen, please join me in welcoming Dr. Agarwal. He has kindly accepted to be the keynote speaker for the session today. Welcome to the session, sir.
Thank you, ma'am. Thank you.
To ask you how complementary are medicine and policing as skill sets?
Ma'am, both are services, so I'm enjoying. I'm privileged and honored and blessed to have got the opportunity to be of service to the nation, to the people in different capacities. So, and thanks very much for giving me an opportunity to be here and speak with you. I'll just put the slides up.
We will just come back to you, Dr. Agarwal, for the keynote address in a few minutes, just in a few minutes after the introduction. Thank you so much for joining the session.
Thanks a lot. Thank you.
Next up, I'm delighted to welcome Mr. Suresh Vazirani, Chairman and Managing Director of the Global Trans-Asia ERBA Group. Welcome to the session, Mr. Vazirani. Could you please share with us in one sentence what inspired you to build the first Indian MNC in the IVD space?
You are muted, Mr. Vazirani, you are muted.
Yeah, thank you, Veena. That's a very interesting question. It was my conviction that India needs a lot of diagnostics. And I really believe that prevention is better than cure. And when I started, there was hardly any diagnostics. So I said, it better be me to start it. So that's where we are 40 years now since Trans-Asia started.
Welcome once again to the session.
Thank you.
We are also delighted to be joined by Dr. Velumani, CEO, ThyroCare. Welcome to the session, Dr. Velumani. All of us would like to hear, perhaps in a brief sentence or two, will there be another disruptive gland-to-brand story from your laboratory? You are on mute, Dr. Velumani, please.
Is that now okay?
Now, yes.
Yeah, if I have to sum up, I'm an accidental entrepreneur. Otherwise, I was a scientist, a government officer rather. But having said that, it was thyroid, which was so powerful, it sounds like an android now. I don't think there is one more gland which could help someone to build a big brand as big as mine. Not only that, I was in the right time, did a few things in a very disruptive manner. Things worked for me, and I will be indeed happy to be a part of today's event and see what I can communicate for creating a better market share for India in the global IVD market.
Thank you very much indeed, Dr. Velumani, and a very warm welcome to you once again. Ladies and gentlemen, next, it's my pleasure to welcome Dr. Kamini Walia, Scientist F at the Indian Council of Medical Research, ICMR. Dr. Kamini, thank you for joining us. And please tell us, how does it feel to be recognized as the Essential Diagnostics List or the EDL Lady of the country?
Good afternoon, everyone. Thank you for this very fancy title, Dr. Veena. But you know, you've been part of this process. And if I accept this title alone, I think I will be undermining the hard work which was put in by my team and all the stakeholders. Actually, I think it was a very timely, you know, that India started thinking about essential diagnostic lists. And if you recall, India did the first meeting of essential diagnostic list before even WHO took up the EDL. So I think the country needed the diagnostic list more than anything else. And the kind of support that we got from the government and the way it has been taken up by the Free Diagnostic Initiative, I think it was an initiative which was well timed, it was well supported. And the outcomes will definitely be very supportive for the diagnostic landscape in the country and for taking us to the 2% IVD levels.
Thank you very much, Dr. Kamini. That sounds very encouraging, and welcome once again.
Thank you.
Next up, we have a very special guest in Dr. Marco van der Looy, Director, Global Business Development, Diagnostics, Hungary. A very warm welcome to the session, Marco. Could you please enlighten us and the audience by sharing with us a bit about how Hungary is tackling the COVID-19 crisis?
Yes, thank you, Ms. Kohli. It was my pleasure to be here as part of the panelists. Thank you for the excellent organization. Yes, stationed in Hungary, I can tell that actually the Hungarian government responded very well to the first wave of the crisis, extremely well. That's why we had actually the lowest infection rate and death rate also among the European Unions. I think the reason for that was that at a very early stage, they had a lockdown. At a very early stage, they decided to make masks compulsory. While many countries were still discussing about the effect of masks, we already had them in place. And also the legal framework to make it possible to, by decree, actually make very fast decision making. We could basically curb the COVID. As of today, actually, they closed down the border for every single foreigner. I came in yesterday very fast to make sure that I can be here. So as of today, actually, nobody can enter Hungary because of the new regulation. So also thanks to the people of Hungary, I think they managed very well to keep the measures and to keep the death cases in place. I hope the same will apply for the Indian people, and I hope this will move soon. Thank you for your invitation again.
Thank you, Marco. Hope Hungary continues to do well and better during this crisis.
I hope so.
Also joining the panel today is Mr. Rajesh Daga, Health of Finance and Neighboring Markets at Roche Diagnostics, India. Welcome to the session. Rajesh, you are an experienced marathon runner. So just wanted to hear from you whether, in your opinion, COVID-19 will be a 100-meter dash or a marathon.
Thank you, Veena. Interesting one. COVID will not be 100-meter dash. It will be a long marathon.
Unfortunately, yeah, that's what we all feel. Thank you so much, Rajesh, and welcome once again to the session.
Sure.
And finally, rounding off our lineup of exceptional panelists, I'm delighted to welcome a colleague from the industry, Mr. Sriram Natarajan, Founder, Director, and CEO, Mall Biodiagnostics. Welcome to the session, Sriram. Right off the bat, I'm going to put you on the spot. Could you describe in just one word the Indian IVD industry's response to the COVID crisis?
Hi, good afternoon. Thank you, Veena, to ask me to be in this panel. I think the Indian industry has responded pretty well. We have a lot of new companies, new startups who have come up and have done pretty well. So overall, I would say that although the challenge was big and the time frames were too short, still, I think the Indian companies have rallied and have done an exceptional job so far. And going forward, I think they will play a big role, the overall COVID part of the story, at least for India. And once the export restrictions are eased out, probably even globally.
Thank you, Sriram. Once again, a very warm welcome to our distinguished panelists. I now invite Dr. Vipul Agarwal, Deputy CEO of Ayushman Bharat, to deliver his keynote address. Over to you, sir.
Thank you, ma'am. Can you see my slide?
Yes, sir. Yes.
Yeah, thanks. Yeah, so I don't think whether this subject that I'm going to discuss with the group has a relevance. It does not directly have a relevance, yes, but indirectly pertains or it affects the IVD market and utilization. So I would just speak on Ayushman Bharat, the project that I'm working on, the current status and way forward. So I am Dr. Vipul Agarwal, as ma'am said. I am Deputy Chief Executive Officer of National Health Authority, which is the implementing agency for two major projects of flagship schemes of Government of India. One is the Ayushman Bharat, which is world's biggest public funded health insurance scheme. And the second one recently launched by Honorable Minister of India, that's a National Digital Health Mission, which is implemented on pilot basis in the 6 union territories. Next. So just in brief introduction. So why this was launched? This project was launched on the 23rd of September 2018. So the basic aspects on which this project was conceived was that more than 20% of the population lives under $2 per day as per 2011 purchasing power parity data. Indians are faced with a triple burden of disease, including communicable, non-communicable, and WCD related illnesses. Most of the population of the country does not have access to quality health care, and every year almost 60 million, that is 6% of Indian population falls below the poverty line, and 62% of the annual expenditure on healthcare is out of pocket. another problem that we used to face when this scheme was launched and conceived was that the state-related scheme, the health being a state subject, most of the state governments are having their own schemes, but there was no portability across the nation of the state schemes, and one beneficiary, especially pertaining to people who were working in outside states like migrant laborers and all, they were not being able to get benefit of the state scheme when they were working outside. So the benefits that we provide under this scheme, we provide a health insurance cover of 5 lakh rupees on a family floater basis to the 10.7 crore families that are listed with us, which includes approximately 40% of the bottom population of the country. The services are portable across the nation, and the 23,000 odd hospitals which are empaneled with us, so the beneficiary can avail the treatment at any of the healthcare provider empaneled with us. And there's no cap on family size, age or gender, and it also covers the people who are having pre-existing diseases at the time of enrollment. So looking at the ecosystem, we have 3 major stakeholders: the payer, hospital, and the beneficiary. The payer, so the NHA is the apex body which implements it at the center with the support of the state health agencies. We are spread across the nation except for 4 states and union territory. 4 states, we are implementing this project in all the union territories and states in the country. And of the 4 states, Delhi has recently announced that it is going to join. So over and above, we have the various components of capacity building, monitoring, evaluation, call center. We have a robust call center of more than 1,000 call center operatives operating 24/7 in 4 cities. And we are also taking care of 1075 helpline of the COVID being launched by the Government of India, Ministry of Health and Family Welfare. We have a robust grievance redressal machinery. It is a 3-layered system, starting from the district officials to the state level, and finally there's an appeal at the level of National Health Authority. We have a robust quality assurance program and AI/ML capable fraud prevention and abuse prevention system that we have put in place. Next. So if the beneficiary has to avail the treatment in our healthcare providers, we are an entitlement-based scheme. No beneficiary can be added over and above the beneficiaries which were initially included as per SCCC Socioeconomic Caste Census-based database of 2011. There is a BIS system in place, so the beneficiaries to avail treatment, they need a BIS e-card that we say. The golden card is issued at 2 places, either in the hospital the patient is finally coming to for treatment. They don't need a card before they come for treatment. They can get a card either at the Common Services Center, or if they don't carry a card, they can directly get the card generated when they come for treatment. Upon a pre-authorization, the patient gets hospitalized, and the request is raised before the state authorities. And once this is approved, the treatment starts, and upon discharge, the claim is processed. The hospital healthcare service provider raises a request for claim. It submits the claim, and the claim is settled either through the state assurance. In the assurance model, the state health authorities directly process the claim, or in case the state has put in place an insurance model, the insurance agency or the TPAs who are empaneled by the state, the insurance company would finally be processing the claim. The entire process is paperless, and there is no transaction which requires any paper at any stage. We are providing services through a all-inclusive package. So the IVDs, the diagnostic services are a part of our packages. We have recently launched the package version 2.0, wherein we have 1,500 plus treatment procedures under 872 packages. So except for few transplant packages and neural packages, we cover anything and everything under the sun. Apart from this, we also provide the standardized packages are defined, and it includes 3 days pre-hospitalization to up to 15 days post-hospitalization care. All inclusive, it includes the hospital treatment rate, medicines, diagnostics, and everything which is required for the treatment of that patient. We also provide incentives over and above the base package rate for NABH accreditation for teaching hospitals for aspirational districts, as we can see on the bottom right of the slide. Next, please. So the healthcare facilities, most of these benefits are already stated. Apart from this, we are providing 60% of the share to most of the states who are implementing this scheme. In UTs and hilly terrain, our share of this thing is 90% of total expenditure, and in the union territories, we without legislature, we give 100% of expenses. Thanks. Next. So as I mentioned, we have a very robust fraud and abuse prevention mechanism in place. We are having a world's best company, which is providing our AI ML capabilities. And so far, we have investigated approximately 1.5 lakh e-cards, of which 87,000 have been found to be having fraud or abuse prima facie. And we are pushing such cases to the state, of which we have lost 6 FIRs, 205 hospitals have been de-empaneled, and up to more than 5 crore rupees have been recovered in terms of penalty. So the milestones, the entire concept of having a scheme like this was conceived on 1st of Feb, and we started operations on 23rd of September, as I mentioned. After running a pilot, and then it was rolled out in 22 states and expanded to all the other states and union territories. And recently, the last month, we crossed 1 crore treatments. So far, we have issued more than 12.5 crore e-cards and 23,000 hospitals. This probably is old data. We have already impaneled more than 23,000 hospitals under our scheme. Next, please. We also last year launched a quality accreditation program wherein we are providing gold, silver, and bronze quality certification. And recently, this week only, we have launched a star rating program also, which was widely covered in the media also. So far, 68 hospitals have been certified as gold standard, and we are providing incentives over and over the base package for getting the gold and silver quality certification, as we have stated on the slide. Thank you. So regarding the beneficiary feedback and grievance redressal, we have already received approximately 64 lakh calls on our call center, inbound, outbound, combined together, and total beneficiaries which have received 98% of the beneficiaries based on the feedback have received help, and 95% of the beneficiaries did not have to pay any money as per the feedback received. The current status of the scheme, most of this I have already mentioned. We have provided a cover of total expenditure of 15,000 plus crore in the 1.15 crore hospitalization that we had so far. And our scheme has also shown a remarkable gender parity also. Most of the benefits have been availed equally by males and females, and 48% of the total treatment has been availed by the females. And the top specialties so far have been ortho and cardio. So as we can see on the right side of the bar line graph, that there's been a dip, and which is all but natural. We faced a decline in the hospital admissions during the COVID times, and again it is recovering. In fact, the private hospitalization has increased. It is more than the pre-COVID times now, and slowly and steadily the public hospitals are catching up. Next, please. Short brief on the NHS COVID response. We are running the 1075 helpline of the Government of India. We are also providing the analytical support in terms of the various monitoring and utilization package profiling, and we are providing inputs to the policymakers. Recently, we launched a hospital empanelment module wherein the hospitals, which many of the healthcare providers were not operating. So we provided this module to give the hospitals a chance to get empaneled on a fast track basis to provide treatment to COVID as well as non-COVID patients during this emergent times. And we are also leveraging ABPMJ IT platform to extend to COVID treatment for non-ABPMJ beneficiaries through TMS transaction management system light version that we recently launched. So regarding the testing and treatment, we have so far tested 80,000 odd COVID patients and provided treatment to 31,000 odd COVID patients, and call centers have catered to around 30 lakh calls during these last 3 to 4 months, and 2,000 hospitals have been empaneled in the last 3-month period. So looking at the way forward, as I mentioned that we are catering to a bottom 40% of the population. Now we are expanding the coverage to ultimately reach to the goal of the universal healthcare as envisaged in the National Health Policy. We are in talks with the various central and state government departments and ministries to expand the coverage to their beneficiaries. As we can see, ESI, Ministry of Road Transport, has recently come out with the amendment to the Motor Vehicles Act, and very soon some cashless treatment for road traffic accident victims would be launched, wherein we are going to play a key role. Ministry of Social Services Empowerment has also approached us to provide a platform for launching the treatment and care for the SC/ST and the manual scavengers. We also are providing our IT platform to CAPS, which scheme would also be launched in due course, and the building and other construction workers also. We are in consultation with the Ministry of Labour and Employment in the scheme. So finally, the missing middle. So there'll always be a population which is not so rich, not so poor, that they're not so rich that they can afford a free treatment. At the same time, it is not so poor that it would require a cashless treatment. So we are providing our IT platform and our expertise and experience gained over the years to give strength to these private insurance companies to run pilots for the missing middle population, middle 20% population of the country. So very soon these pilots will be launched, and we would, through our support, provide hand-holding to these private insurance companies to run their pilots with to the middle class population of the country, so that the healthcare becomes affordable and accessible to all. Thank you very much. Once again, I would say that this subject directly might not be touching the IVD, but at the same time, in the next year, we are targeting a beneficiary treatment base of 2 crores. So as we expand our treatment base, I think it would create a cascading effect, and IVD market would indirectly tend to gain. And we would request this group and this panel to kindly guide us, keep guiding us on implementation, also as to how we can make our package best suited to the needs of the various healthcare providers and the stakeholders. Once again, thank you very much for giving me a chance to speak. Thank you.
Thank you very much, sir, for sharing such a comprehensive update on the implementation of Ayushman Bharat. We are very hopeful that a significantly large number of additional IVD tests will be conducted under the Ayushman Bharat scheme, which will help to increase the market size of India, thereby increasing our share in the global IVD market. Thank you once again, Dr. Agrawal, for sparing time to be part of this session. Thanks once again. So we will start the discussions with yourself, Mr. Wazirani. You've seen the Indian IVD market over the past 4 decades. What, according to you, are the missing links that have caused India to remain only 1.5% of the global market?
Veena, I don't know if you can call it a missing link. I feel it's part of a evolution of the healthcare in any country. You know, in the beginning, the priority is always to treat the emergencies, treat the people who are almost dying. So that's where India has focused so far, which is basically tertiary care. You know? So you focus on the cardiac surgeries and dialysis and all those emergency situations. But at the same time, a country like India cannot overlook the need for long-term health of people, which is basically preventive. You know, we all, as kids, we learn prevention is better than cure. Yeah. So that's very true that in healthcare too, preventive healthcare is, in my opinion, as important, if not more important than the curative healthcare. Because, you know, as you said, India is 18% of the global population. India's global GDP is 4% of the global GDP. but the IVD spend is only 1.4%. So obviously, there's not enough diagnostic testing happening in India. It's happening in the tertiary care, but not in the primary care. So this is where I hope our country will focus, and I think it has made a beginning. The Ayushman Bharat has already come up with a plan to start health and wellness clinics. I believe that 150,000 HWCs are being opened all over the country, and each health wellness center will cater to 5,000 population. So I do hope that will be a big boost to the preventive healthcare, and connected with that, diagnostic plays a big part in preventive. Recent survey showed that in India, 50% of the people who have diabetes do not know that they have diabetes. I mean, can you imagine that? Only about 50% population and those diabetics know they have diabetes. Rest 50% are walking around without knowing that they have diabetes. So, suddenly they fall ill, they go into a hospital, they have kidney failure or whatever it is. If they were taken care in time with just few thousand rupees, the country would have saved lakhs of rupees on dialysis and those things. So this, I believe that we look forward to Ayushman Bharat. We look forward to Dr. Agarwal, if he's still with us, that please expedite the HWCs and make it possible for every Indian to be tested for some basic diseases. Essential diagnostics, as Dr. Kamini Walia has mentioned, the essential diagnostic test should be done on every single Indian, if not once a year, at least once in 3 years. That could be a great beginning, and that can be a great factor in creating a healthy and happy India, which is our dream, to create healthy and happy India. So I do hope that this thing will start. Ayushman Bharat will lead us into a healthy and happy India over the next few years. Can't hear you, Veena. Yeah.
Now, can you hear me?
Yes.
Yeah. Thank you very much, Sureshji, for sharing your insights and assuring us that we are on the right path, moving from tertiary healthcare to wellness and prevention. Thank you indeed. Next, I would like to come to you, Dr. Kamini Walia. You've been closely associated with the development of the National Essential Diagnostics List, like Mr. Wazirani mentioned, the draft of which was released in December 2018. We haven't heard much about it since then. Could you please share the plans of ICMR on the implementation of the EDL?
Thank you, Dr. Kohli. So as you would know, that the first draft was released in December 2018. And subsequent to that, it was basically to invite any stakeholders' comments which we may have missed out. And once that exercise was completed, we released the final list in August last year, 2019. Since now, all of you, I'm sure, know about the Free Diagnostic Initiative of Ministry of Health. And NHSRC is the implementing arm of the Free Diagnostic Initiative under the National Health Mission. And NHSRC was very much part of the consultations that ICMR did for creating consensus on the final essential diagnostic list. And it is very heartening to note that most of the tests which have been recommended by EDL have been adopted by a Free Diagnostic Initiative. Almost 90 to 95% tests have been taken up by Free Diagnostic Initiative. And last year in December, Free Diagnostic Initiative organized the meeting of all the states to understand the progress of implementation. So Free Diagnostic Initiative is being implemented almost in 29 states across the country. And I'm sure somebody from NHSRC would be able to give an updated idea on that. And different states are using different models for implementing free diagnostic initiative. So to answer your question that what has changed since December 2018, I would say a lot has changed on the ground, that in the sense that the implementation part of NEDL has already been initiated. And I would like to compliment here the cooperation of NHSRC that we got during the process, as well as how they have taken the NEDL and adapted it to the free diagnostic initiative for implementation. Can't hear you.
Can you hear me now? So this is very encouraging and positive news for the industry as well as the country as far as healthcare is concerned. Thank you very much, Dr. Kamini, for giving us an update. Next up is a question for Mr. Sriram. Sriram, do you believe that technology is one of the key missing factors that has restricted the size of the Indian IVD market? And how can technology be made a game changer for the domestic market?
Veena, before coming to technology, I think, first of all, we have to understand that it's all about money finally, right? And so if the Western countries have been able to provide the level of healthcare they're providing now, and that they are contributing 75% of the global IVD market, it's simply because they're putting the kind of money, not only to buy the kits and get the patients to use these kits, but the tests, but also from the point of view of setting up a robust healthcare system, which takes care of, and with a large amount of funds going into it, directly from the government as well as through other things like the insurance schemes and so on. So they've been able to build that kind of a ecosystem, which takes care of every aspect of the healthcare chain. And technology is also a very important part of it. That's why if you see most of the innovations, let's say, have all come from Western countries all the time. It's not because we are not capable of doing it. It's just that these people have been in an ecosystem which helps them to bring out the innovations much more effectively, and also have enough funds to take it forward, because these kind of innovations take a lot of money too. And so those enabling features are the ones which have made technology also coming mostly from Western countries for a long time. So because of that, countries like India have been dependent on Western countries for most of their medical device requirements too. So even if you see, for a long time, most of the medical device market in India was all coming from imports. There was very few Indian, IVD or medical device manufacturers in India who were doing things themselves. So I think we have to address that very clearly. We have to create an ecosystem for innovations to happen. Innovations and technology do not happen just like that. So that has to be kept in mind. And so we have to build the ecosystem. We have to ensure that there is some kind of roadmap very clearly laid out about how various aspects of this ecosystem will come into play. Things are happening in bits and pieces now. They're seeing that the government is promoting these medtech clusters now. They want to bring in more capacity building in the medtech area, especially in medical devices. But it's all happening slowly. I think it's going to take a long time before we have enough such clusters coming in to promote innovations coming from India. But having said that, you're completely right. Technology does play a big role. And if we can make those technologies here, and especially considering that the kind of requirements we have are much different to the Western countries, our diseases are different, our overall health structure is different. We have seen this in the COVID pandemic, how unprepared we were as a overall health infrastructure. So the health infrastructure is an issue. Market access is not very clear. So all those kind of things have to be tackled. And if the kind of ecosystem can be built, and if everybody can come and play a role, including, I would say, ADMI should play a big role in this too. And I'm sure it is not too far that we will see a lot of innovations happening in India, and not too far that we will also be owners of technologies which can be applied to Indian conditions, right? Because when I keep saying Indian condition, because in India, from our experience, we are seeing that it's more important to serve people at the point of care. That's something which I strongly believe in, because of the various logistics issues and the way the health infrastructure is still very inadequate, it's becoming very difficult for people to even seek access. So we should try and reach technologies to the people than expecting people to come for technologies. Those kind of things are more specific to India and to developing countries. And so from that point of view, innovations coming from here can address the kind of scenario that we see in India, for example, much more than probably what Western countries can do. So that will make technologies and the products more affordable and also fit into the overall scheme of things. But I think very important is to have a clear roadmap. Today, I think that is still not there. We have various things happening, like Ayushman Bharat is a great initiative, undoubtedly. But the industry is still not part of that. So it would be nice to have all stakeholders coming together and working on a clear roadmap, keeping a much more long-term vision in mind, and trying to see how regional capacity building can happen and regional innovations can keep happening.
Thank you, Sriram. But do you think that the stage is being set for technology in India with the academia industry collaboration that we've seen pick up momentum during the COVID-19 crisis? Just in a sentence.
Yeah, it's happening. I agree with you, but it's been more COVID-centric right now. Right?
Yes.
Just because COVID was a global pandemic and every country had their own requirements, so India was pushed. And so because of that, a lot of things have happened. So we can see very clearly that if you do put in efforts and if you do focus, you can do things, you can make things happen. I hope this will continue, and this will continue into a much broader, way to go forward in the future, because that's what is going to make things different here.
Thank you very much, Sriram, for your insights. And now to get a global perspective, we move to Mr. Rajesh Daga. Roche is one of the leaders in launching IVD markets globally. How does India compare to other countries in embracing such innovative solutions, Rajesh?
Thanks, Reba. India is a little slow in embracing, technology, and there are multiple reasons for it. One is what Mr. Wazirani picked up was about, the need for the patient. Basically, when does a patient go to a lab or a hospital? He goes for a treatment and not for a prevention or a preventive screening. And technologies will help in bringing about more proper preventive screening, and much better overall healthcare will improve if we embrace technology faster. In India, the focus is still on cost, and there is a reason. We are out-of-pocket market, and anybody who goes will go only if there is a need for it. Otherwise, patient will not go there. So the focus still continues to be on cost. And when you embrace technology, you have to be ready to pay a little more, and that is what is the missing piece here. So we need to see how, and again here Ayushman Bharat will play a role here, in the way it is. Currently, it's only at the bottom, but hopefully over a period of time, it will play an important role. However, over the last few years, we have been seeing labs and hospital chains are willing to, take and invest in technologies, but the speed is slow. It's not everybody is willing to do it. COVID has now played a very important role here, and the way patient care is happening, a lot has changed. Labs have also innovated very quickly, and as an industry body, we should take this opportunity and ensure that we capitalize here and quickly adopt to newer ways faster.
Yeah, that was quite thought-provoking, Rajesh, and a lot of learnings. Thank you very much. Carrying on and building upon this theme, our next question is for Dr. Marco. Marco, you've been working closely with diverse IVD markets across the globe. How would you compare and contrast the IVD market in Europe with that in India?
Same way. Can you hear me? Yes.
Yes.
Okay. So if you look at the world IVD markets, you mentioned US, Europe, Japan, they count for 80% of the IVD market. These are, in fact, mature markets with growth rates of 5% or even more, depending, of course, on the current COVID problems. And if you look at the socio-economic drivers that count in those areas, we look at your aging populations, increase of cardiovascular diseases, chronic diseases, infectious diseases, but also personalized medicine, which maybe in India is still only starting to be appealed. We heard Mr. Wazirani speak about the wellness centers. These are just coming up, although there are already, let's say, normal procedures in a lot of different countries. So also we see, I think, a shift from treatment to prevention, as mentioned. So if you go through prevention, obviously the healthcare system and the IVD industry will follow that, specifically with the coming of private companies that have the innovative background to start their business in this. What we see also in a lot of countries is a shift from the volumes, large labs, consolidations of testing, but also at the same time focusing on specialized testing. Specialized testing may be for some IVD segments in India still very early stage. If you look at, for example, hemostasis testing for special testing or other areas, they focus basically on the routine basic testing, and this is still for many people not available in India. And it's very good to hear that there are steps being made to improve such schemes to bring basic testing for the large population. And of course, our knowledge about testing itself and about new markets coming out and technologies increasing brings us vastly further. What we see is automation in laboratories, and also a huge surge in point-of-care testing. Point-of-care testing in India still started to appear. If we speak about plans of the government to improve rural areas for diagnostics, point-of-care is a very good way to bring diagnostics to further areas, and also maybe to encourage people to do self-testing in a sense not possible by the local lab systems. Also, reimbursement systems well established in many countries. No doubt you don't have to go for out-of-pocket payments in other countries. Still in India, it's a big issue as we have heard. Now, there are basic global factors that are also affecting India. The first is the price pressure, especially now in COVID time when the budgets of governments are reallocated to COVID testing. It's of course very necessary. Also affecting, of course, budgets available for other testing in the near future. Testing itself, as we see it, is also getting commodity. So big labs, big testings, payments, and cost per result, basically, not cost per instrument. So these are all ways to cut further the prices. And unfortunately, diagnostic is still seen as an easy source to cut additional costs in a certain budget. Or as the other important issues, we see big pressure coming from increasing regulation. This is specifically in the US and Europe, a big issue now. Also for India, it's coming. Harmonization of IVD medical device requirements, quality issues, registration, proofs of performance, and of course the requirements of local authorities. So, for example, the IVDR that we see coming in Europe by 2022 will have much stricter regulations for the manufacturing and for the marketing of the IVD product, even sometimes stricter as the FDA. And these changes will probably also change the IVD market as we know it. The real manufacturers, the real added value companies will probably survive. But, a lot of marketing ways like OEM or ODM or private labeling will of course become standing in a different viewpoint. So in India we are beginning to see similar approaches and similar ways of moving forward, which is a very positive way, I think. And there are signs that the quality of the healthcare system is upgrading. There's a willingness to make basic circumstances to make startups possible, to make innovations possible. And we've seen uprising in the private sector in this respect, and the government is doing a great effort to as I mentioned, to improve the rural health and the urban health programs. This offers exciting opportunities for the future. So I think as a member of a foreign company, I think there's great opportunity in India, and I truly hope we can contribute to this quest and bring good diagnostics to India.
Thanks, Thakur. There's clearly a large gap to be bridged in India as far as diagnostics are concerned. But I'm tempted to ask you just a follow-up question, because you've been involved with it, that with the implementation of the new medical devices rules, which got implemented on the 1st of January 2018, do you think the regulatory machinery of the country is now quite comparable and at par with Europe and other developed countries?
Yes, I think the first steps have been made, I think, 2 years ago. I think it's very important that India makes such steps, because to bring high quality diagnostics is one of the major concerns and major challenges for the future. On the other hand, I know very well that if you bring in more restrictions and quality issues, is of course making it more difficult for companies to enter, but this is the way forward. We have to make sure that the diagnostics brought to the people is perfect. And I think with those measures, the Indian government makes a good step forward, and specifically for the. We also have been seeing in Europe and beyond specific programs to align those regulations. I think it's a very good way forward. Yes.
Thank you very much, Marco, for all your inputs. Dr. Velumani, next I'd like to come to you. According to you, what policies should the government of India implement to help the Indian IVD industry garner a significant share of the global market?
Yeah, thank you. So the market size is too small is not the worry of the players. It should be the worry of the government, because we can't play until the government creates an opportunity for us to play, motivates us to do that in a much better way. Now, as we all have discussed, Dr. Agarwal said 40% of the population is with less than $2 per day income. It is very paradoxical to see India second largest in the population, sixth largest in the GDP, but not even 100th in the per capita income. It's a very unique situation. I don't think any other country with such a low per capita income can aspire to occupy the global market just because it is nice to occupy. Having said that, we need to start somewhere, and the government should provide an infrastructure. Every entrepreneur cannot run around creating buildings, creating that which is needed for manufacturing. So there can be a lot of biotech parks where entrepreneurs can be given either free or very subsidized infrastructure to start and work on it. Government itself should purchase only from local manufacturers. Then only local manufacturer will find a kind of motivation, because there is a market. Without market only, all you players who are sitting here and talking are having one big problem: where is the market? And the government is not even buying from Indian, it is buying from globally. I see that happening. So if they purchase, they can standardize, and they can promote, and in fact, if really you want to take this 2% to 15%, government should give tax relief in terms of every tax, GST or income tax, for at least a period of 10 years till this industry size becomes a 15%. And of course, government itself is not spending on healthcare. It's only 1.5% of the GDP. Why it can't spend 5%? When the entire world is spending 15% also, not entire, all developed market. Patient is not spending. He himself is not. First, he doesn't have money, and the guys who have money are also not spending, because for him it is not the priority. So this is from the government side. And let me tell you what is happening from the laboratory side. I am only player here in the panel who run a laboratory also. With all said and done, globally, India is cheapest in healthcare. But in India itself, the cost of diagnostics is unfair, too high. And we must make sure the pricing is brought down so that the consumption goes up. And without the consumption, the volumes will not happen. And no one accepts local brand. 25 years back, I wanted to be an IVD manufacturer. But all whom I met told, no, we want only European, we want only the Western world. So I fortunately now become a very rich man because I was rejected. So this is a rejection which every Indian brand is today having. And of course, we are only selling glucose, we are only selling TSH, we are not selling the tests which are having much higher value because the doctors, we are not creating any awareness. They are only asking what they know. It's a big block that we don't consume the true healthcare sufficiently. And of course, I want to also take another 2 minutes to explain what the role you guys can play. You are all very important to play because unless otherwise you have a plan and a roadmap and work, it won't happen. First and foremost, volumes are not there for all of you. All of you, majority of you having a turnover of somewhere between 2 crores to 20 crores. Only very few have more than 100 crores turnover. So there is a lack of volume. Because of lack of volume, lack of size for players, and investments are not done adequately. We are only doing a minimum basic investment. Unless otherwise our infrastructure is sufficiently big to produce huge quantity, how are we going to see a global market size? And plenty of the manufacturers are not utilizing the capacity more than 10% to 20%. Everybody puts up capacity, but they don't use the capacity because a standing machine is a liability and a running machine is an asset. So this has to be kept in the mind for the manufacturers. There are no collaborations happening. Everyone is competing with each other and everyone is doing the same thing parallelly. Unless otherwise there is a kind of collaboration, it's not that easy to occupy global market. And of course, somebody should specialize only in hematology. Somebody should specialize only in photometry. Somebody should specialize only in immunoassays. I think this makes a lot of sense. I'm very happy to see Sriram, who is focusing only on Malbio. So it's very important that somebody focuses and create a specialization. So that is my inputs. Now that you gave me time, I didn't know whether I will get time once again or not. So I could finish my communication.
You will definitely get, sir. So thank you very much for your valuable suggestions on what the government should do, what the laboratories should do, and what the IVD industry players should do. And I just wanted to add something which happened during yesterday's panel discussion, wherein we had Mr. Rajesh Gupta from DPIIT. And he explained to us about the public procurement order, which was released in 2017, which has now been revised on the 4th of June, 2020. And it has made it so favorable, so friendly for the Indian manufacturer that the government says that public procurement has to be done through the GEM portal. And if there is a local manufacturer that has a local content above 20%, then the purchases should be done only through local manufacturers, and there should be no discrimination and no, conditions of, let's say, the turnover or the number of years that the company has been active in the business, which could remove them from their eligibility in participating for that tender. So that's been really, really very encouraging. And I think the way the GEM portal comes up with the new announcements of tenders from various states, it looks that the PPO is also getting implemented in the right way. And that's definitely going to increase the demand for domestic diagnostics products. I think the biggest favor that the government can do to us is that they should, like you said, Dr. Velumani, that they first should start buying the domestic products that already exist. We have 136 parameters of IVD for which there is sufficient competition, there is sufficient installed capacity, and the local content also matches with the description given by the Department of Pharma. And very recently, we heard that the Department of Pharma is going to incentivize the in vitro diagnostic sector, just the way we have an AMTZ for medical devices. The IVDs are also going to be incentivized, and we've asked them to come up with 2 to 3 clusters, which would give the manufacturers local raw materials at a reasonable cost. What we really need is actually some antibodies, some antigens, some enzymes, and a Cubitana, to move to the 75% self-reliant mark in IVD reagents. Of course, in IVD instruments, we have a large gap and we have a long distance to travel. Thank you very much, Dr. Velumani, for all your insightful thoughts. Sticking to the subject of government policies, let's now bring in Dr. Kamini. Dr. Kamini, the National Essential Diagnostics List encompasses a wide variety of IVD tests, ranging from the routine tests like clinical chemistry and hematology to the more specialized tests like molecular diagnostics, therapeutic drug monitoring, and flow cytometry at all levels of the healthcare. So according to you, approximately what number of additional IVD tests are expected to be conducted in the country with the implementation of the National Essential Diagnostics List?
Thanks, Dr. Kohli. This is indeed a very intriguing question, and I was trying to look for data past 2 days as to if I can give you a ballpark figure on for the nationwide, like how many tests we are going to need. But unfortunately, I was not able to do that because for a few reasons. There is considerable heterogeneity in the way the NEDL and the free diagnostic initiative is being rolled out, depending upon what is the ability of the system which is available to undertake these tests. So the states have been given some flexibility as to if they would like to start in the phase-wise manner, or how they want to move forward. But I was particularly impressed when I saw the report from Assam. If you see, they have a good web page on the free diagnostic initiative and other health services which are being provided free of cost under NHM, and diagnostics happened to be one part of that. And it was the system gave service to 27 lakh people ever since it has taken off in last 2 years, I think, 18 onwards till January 2020. This was the data. 27 lakh people have been given services. They have been treated in the system. And every month, the tests which are conducted, which does not include the X-ray and the ultrasounds, the lab tests alone are between 4 to 6 lakhs. So this is the kind of number that one state is putting forward, which are the monthly tests, and that anyone can verify once you. So many states are now implementing, as I mentioned previously in my comments, some are taken up the public-private partnership, some are using their own system. So as we, I think, widen the treatment, base, how many people are being treated, and if we also follow the proper, protocol of treatment, which is like going from proper diagnosis to treatment, it is really going to increase the numbers. I will not be able to provide you the exact numbers. That someone from NHM or some economist, I think, is more capable of doing that. But till now, the entire diagnostic services was limited to the tertiary care, and many of the previous speakers have previously highlighted this particular issue, and it now needs to move down to the next levels of healthcare, and that alone is the, I think, driving force for whether you call it a NEDL or free diagnostic initiative or many other initiatives that Government of India has taken. So expanding this also brings in a lot of opportunity for expanding the diagnostic base to the rural healthcare, the tier 2, tier 3 cities through the system which has been proposed.
So it's very encouraging, Dr. Kamini, to hear that 4 to 6 lakhs additional IVD tests have been conducted in a single state in a month. And this is especially pertinent at this stage when we see a sharp decline in demand for non-COVID products. The COVID products demand, of course, has been overwhelming, but the non-COVID products demand has gone down to, the estimate is, to 1/3 or half, of what the value it had given in the calendar year 2019. So at this point in time, if we were to have an effective implementation of the essential diagnostics list, not just in one state, but across the country, it may really help the industry. There are going to be some small companies that are going to shut shop because they don't have a demand for the products that they manufacture, which were all routine non-COVID products. So the companies that have changed along with the COVID crisis and have developed COVID-related products are being able to manage. but the ones who have not are really finding it difficult to survive. So do you think under these special circumstances of the COVID crisis, the government could step up the implementation of the National Essential Diagnostics List and help the industry, therefore?
No, this is a very important point, that the non-COVID tests are not in demand. It is not that they are not in demand. It is just that people are not visiting the health facility. There is a lot of fear in visiting, whether it is visit to a doctor or visit. So the tests are just being, avoided because nobody wants to visit healthcare facility for giving blood or those kind of things. Although a lot of private companies are able to, take samples from home and, deliver the tests. But then again, the private labs are not, they are not that spread out well. They are still concentrated in the tertiary centers. But your question is a difficult one, I would say, because when the whole country is actually focused on COVID and the COVID-related crisis, and so is our healthcare force. The most of the lab technicians, I run the antimicrobial resistance surveillance network, and my entire staff, which I have provided in all the centers, have been diverted to COVID work. But I'm not complaining because this is a national crisis. Yeah, I think your suggestion does have a promise, but then it is for the government to see, how much fund that they can really divert to non-COVID kind of investigations.
We understand. Thank you very much, Dr. Kamini.
Thank you.
Let's move to Mr. Sriram once again. Sriram, your company had introduced an affordable RT-PCR test on a portable format for the detection of tuberculosis. Did it help increase the number of diagnostics tests being conducted for TB in limited resource settings?
Yes, indeed. Can you hear me?
Yes, yes.
Yeah. So, as I said, we are seeing, for example, in India, a lot of mortality and morbidity happening just because of infectious diseases, which are otherwise easily curable, not getting diagnosed in time, and people not getting treated in time, the disease becomes much more complex, and they then have to go to tertiary level of treatment and so on, just because the early diagnosis was not happening. So that's been the driving force for actually our getting into a point of care molecular diagnostic platform. Because having said about various kinds of diagnostic tools, finally, molecular diagnostics is the most reliable technology for diagnosing infectious diseases, especially if you want to do it early. And so that's where we came in the picture. That's why this platform was developed, that we have the TrueNet platform. And of course, the lowest hanging fruit was TB, because TB was having the biggest unmet need. For example, in India, we have DOT centers, 14,000 DOT centers doing TB diagnosis using a 150-year-old technology, which is smear microscopy. And it's very clear that sensitivity is very highly limiting in this technology, and so you have only about 40 to 50% kind of sensitivity levels that you get. So in spite of this DOTS program being implemented for the last 35 years, and in spite of government giving free diagnosis and treatment, TB was not coming under control. So it was obvious that it's just because we are missing a lot of cases. So that's where we came in the picture, and the belief was that this technology can go to the primary centers, to the DOT centers, where they could do straight away a first-line test using a molecular diagnostics instead of doing smear microscopy, so that their case detection goes up significantly higher. People get diagnosed early, and then they get the right treatment, and so the overall TB burden over a period of time will come down. And that was the basis on which we started this whole thing. And of course, the government also committed to eradicating TB by 2025, and so that accelerated the whole thing. So there has been a big uptake by the central government and some state governments in terms of deploying our platform straight away for screening at the DOT centers and primary centers. And Andhra Pradesh has done it. They were the first state to do it. Now it's about 1.5 years, and it's made a big impact. They're so happy that they went ahead with this program. They're able to detect about at least 50% more. That is the kind of people you're missing, and put them on treatment. And so the overall outcome in terms of people getting treated on time, definitely their mortality rates came down significantly. And over a period of time, they're expecting that even the transmission rates will come down, because once you start treating people early, then they're not going to spread TB to other people. So I think as they go along, they will probably be able to see TB burden coming down significantly. And that's what the central government wants to do. So we are now in the rollout phase for the RNTCP. They are wanting to deploy this platform across India. And so we definitely are seeing a big impact happening already for TB. And with COVID coming in, we could easily bring a COVID test in the same platform. And the last 4-5 months, I mean, a lot of COVID tests has been done using this platform at the primary levels. I mean, I'm not talking about central laboratory at all. You know. So it is making a big impact, and I think it makes a lot of sense for infectious diseases to be treated, diagnosed and treated right at the point of contact.
Yeah, Sriram, does it corroborate the point that taking IVD tests from the lab to the patient is going to increase the demand for the tests?
Yeah, I think both the models are going to be important. A central model also is extremely important, because at the point of care level, you're just doing limited testing. It's based on a patient basis. Whereas when you're wanting to do large scale screening, it is not possible at the point of contact, at the first, point of care. So depending on the importance of the test and its need at the point of care, that's what I think will be the major focus. And tests which don't need such a urgent kind of attention don't have to be at the point of care. They could still be at the central level. So I think it's going to be a mix as we go along. But for infectious diseases, I'm sure point of care is going to be extremely important, especially when we're talking about antimicrobial resistance. We're talking about people developing all kinds of resistances. I think it's very important that people get diagnosed as early as possible. First, they get cured, and number two, they stop giving it to other people. Both ways.
Makes a lot of sense. Thank you very much, Sriram. Now I'd like to invite you once again, Mr. Vazirani, to share some insight. Your company has subsidiaries in the US and Europe, the leading global markets for IVD. What learnings, sir, can we carve out from these markets to help India secure a higher market share?
Well, one thing is these countries have already realized the importance of blood testing. That's why in most of the developed countries, every citizen is expected to be doing blood tests between 6 months and 1 year, depending on the age, of course. And that helps them remain healthy. So that's one thing that has also created a huge market for diagnostics in those countries. But another reason is we are talking about Atmanirbhar Bharat now. But in many countries, Atmanirbhar has been a driving force for many years. I mean, a country like, of course, China, we know that, they started Atmanirbhar China 20 years back. Brazil started about 10 years back. Russia started, many countries. So more and more the countries come to realize that healthcare and medical devices is as essential as defense. You can have guns and all that to fight, but how to keep the population healthy, that's as important as the defense. And that's where the Atmanirbharta comes. At a time like COVID, we saw that many countries refused to allow the companies to export. Like, Mr. Trump said that, guys, you sell to America first, forget about other countries. Obviously, India would also do that. I don't blame them. So that makes all the more important that India has a strong manufacturing base for diagnostics. COVID is not the last of the viruses we see. I'm sure there'll be, happening in future too. So it's important that before the next COVID comes, India is fully ready in advance for a growing diagnostic industry, which can immediately cope up with the demand. So that's one in terms of the essentiality. Second part brings is the affordability. Dr. Velumani mentioned about the average per capita income in India is so low. Typically our average per capita income is 500 rupees a day. That's average, considering the rich and the poor together. But at the minimum can be like 200 rupees a day. Now, how do you expect a person earning 500 rupees a day to go for a blood test where the instruments and the reagents are made by somebody sitting in Germany or Japan who's earning 1,000 rupees per hour? Can you see the proportion of it?
Yes.
A worker in Europe or Japan would at least earn at least 1,000 rupees per hour. So how can those devices be afforded by somebody who's earning 500 rupees in a day, in which he has to eat, he has to look after his family, education, all that? So it's impossible, right? So we are trying to do something that really has no impossible. It's very important that we have a strong mechanism to make it affordable, where a person earning 500,000 rupees a day can afford to go for a blood test once in a year or whatever it is. Of course, as we all know that IVD companies can only provide low-cost diagnostics, but for the test cost to be low, we need more like Dr. Velumani to do that. We have seen the huge multiplication factor between the cost of the reagent and the cost of the test charged by the laboratories, which I'm glad that Dr. Velumani is trying to make it affordable test. So it has to be a teamwork between the IVD industry and the diagnostic labs to together make affordable tests so that everybody can afford it, and that will really boost the market. So it's like it goes for a circle, it's the supply and demand goes, and then, so this is where should be the work closely with the labs, with Dr. Velumani, to make sure that every lab is made affordable across the country. Of course, over time, I can see, not only over time, I can see that next 5 to 7 years, we are also working on developing a machine. We call it ATT, like ATM. This will be anytime test machine.
Ah, lovely.
So like an ATM, instead of money, you go for the test, you put your arm, the blood will be taken, and in whatever time, you will get the report. Maybe that cost will come to like, 5 rupees, 10 rupees a test, something. So it's not very far off, because technologically there's nothing to hold it back. We have all the technology available. It's just a question of putting it together with the right software to make it affordable. So you can have every shopping mall, you can have every hospital, every public area having ATTs, where, of course, every done that. Understand that there are a lot of tests which the doctor has to see the slide. But at least 70 to 80% of the diagnostic tests are what we call digital tests, where the report comes directly digitally from the machines. So those can very well be done on these ATTs, and where the affordable cost, imagine having a glucose test for 10 rupees. Anybody can go and do the test like. So this is something that technology will bring. And as I said, that earlier the better, because we do want to see healthy and happy India, and diagnostics plays a very big part in making healthy and happy India.
These are very innovative suggestions, sir. Definitely, IVDs are moving to Walmarts and Walgreens in the US, and we could make that happen in India. Of course, like you said, Dr. Velumani needs to take the lead in that, and we can see that happening in Navi Mumbai soon. And I also like the comparison that you made between healthcare and defense, and how both these need to be given equal priority, because the real warriors that we saw during the COVID crisis were not the machine guns and the AK-47s, but they were the doctors, nurses, and the paramedics. Thank you very much, Dr. Mr. Rajesh, let's bring you back into the discussion. What, in your opinion, needs to be done on a priority to increase India's share of the world's IVD market, and what is Roche's opinion also on the same?
Thanks, Veena. See, India market is very distinct. You have two separate segments. You have the urban and the rural. And we need to think of solutions which will be different for each segment. Coming to the urban segment, there should be an investment in technology much more than what it is happening currently. Not only to bring in efficiency for the labs and the hospitals, but also to ensure complete patient care. Not only in the hospital sphere, but even outside the hospital sphere. Ensuring patient monitoring beyond the hospital. But a lot of work needs to be done still on the rural side. And here we should partner together with the private players for preventive screening, in developing the healthcare infrastructure, and for building the skill for the local talents. That's very critical, because you may even have technology which may go to the rural area, but you need skilled manpower to understand and take it forward. So these are the three key areas in the rural segment which needs a lot of work.
So technology, as if I could rephrase that, technology surely is one of the enablers to increase the market size in India. Thank you very much. Marco, coming back to you, as we understand your organization, Digon, is planning to set up direct presence in India very soon. Could you please share what attracted Digon to the Indian IVD market?
25 years of global presence. We have subsidiaries, we have distributing partners, we have contract manufacturing partners with quite a few well-known companies. And of course, we also have a great experience in technology transfers. We have done projects in Asia, Middle East, Russia, and also in India, as mentioned. We have almost 10 years of successful collaboration, also with localization of certain of our products, with raw material supplies and so on, for hematology reagents and blood control. So following this successful first 10 years, we think it is important now to make a step further. Our main core business is hematology and hemostasis, complete systems from point of care to high throughput systems. And we see that in India, there's a great potential for these products, specifically for hemostasis products, where we see it's still a very immature market. It's very segmented, and every segment has its own special requirements in pricing, in support, and so on. And given this coming new reimbursement system, we think also the number of tests will increase in the future. I think for hemostasis, the growth rate expected is around 10 or 15% for that specific IVD segment only. But also hematology is number 3. And of course, the basic testing is increasing. Still, a lot of people have no access to basic testing, including basic blood cell count. Of course, we see the restrictions as well. There's a strain on the healthcare budget. There's a price pressure. We have spoken about this in general. Products from the West are more expensive. So, of course, to be able to decrease prices, we need local presence and we need local manufacturing capacity and to expand it. So we think that fits very well in the policy of the Indian government to improve local manufacturing and bring innovation and bring raw materials or technologies from outside. It is our goal, obviously, to sell and to expand our business in areas and to bring our expertise. And this, I think, will fit very well to the goals of the Indian government to promote this local manufacturing with outside help. As mentioned, we see an increase in these businesses, and also we see that with the local footprint, we can much better provide support. Any market is a difficult market. It requires to build local knowledge of doctors, of technicians, specifically for special testing. Also, we have heard the necessity for this. I think with our support system, we can play a role in this and to enable our technology to be used in a very good way in the diagnostics market. So we are very positive in this, and I think also we're very excited to be part of this quest. Thank you.
Thank you, Marco. Strong reasons indeed to choose India to expand your global base. And it's good to know that you'd also be bringing in technology and manufacturing onto the soil of India and not just the sales and marketing offices. Thank you very much.
You're welcome. Thank you.
Finally, Dr. Velumani, we will close off with yourself with what is the last question of today's session. And I'd request you to be very forthcoming. Quality and service, of course, are two very important components of a good system. You've had MNCs as your suppliers, you have Indian manufacturers as your suppliers. So please be very honest and tell us, what do Indian manufacturers need to learn from MNCs with respect to quality and service from your viewpoint?
I'm clear. Hello?
Yes.
Right. So I don't segregate local separate and MNC separate. To begin with, I was only on immunoassays. In immunoassays, there has not been even today much of local players when I talk about the core lifestyle disorders. I came in then to photometry, and photometry, there are a lot of local options available. But when you look at a big lab like us, we want elephants as an species, so that it carries more and it is giving a lot of throughput. So if you ask me, we are largely automation dependent, the analyzer dependent. The bigger the analyzer, more happy we are. For us, CapEx is not a challenge. So we do see that as one of the reasons why I am not purchasing much from local players, photometry also. And the large players also look at player like us, and they give us medicine without buying because the volumes are very motivating to them. So if you look at it, it is not because I like a multinational brand or I like something fascinating, but it is driven by the compulsion of needing hardware, and hardware that can capability-wise do much more. And also for us, servicing, I don't see MNCs doing any better service because all servicing is done by our boys. The ones who are locally bred boys. So whether you have your staff or we MNCs have their staff, in fact, MNC staff may not work on Saturday, Sunday, may not pick up the calls, but I think the domestic vendors and suppliers, boys are more attentive there. So service is not a problem. Quality is not a problem because I don't think chemistry is any different truly, but a good automation gives a better solution for a big laboratory. That is my frank opinion. In terms of hematology, I yet to see local manufacturers big. Only the imported ones are being sold either directly or some people are repacking and selling. And there also we don't see any true local options available. And we are not into the POCT side. We are not into even infection-wise a big market. Our 90% of the total business is wellness, in which to begin with it was 100% immunoassay and 5% photometry. Today, because of our Arogyam kind of profiles, it is 70% photometry and 25% immunoassays. So you be assured that the bias is not, at least for me, because I myself is a brand. I don't have to sell an MNC brand to impress the common man. If there is a good system in place, if there is a power in the medicine, and if the pricing is certainly beneficial, I will certainly jump in. But I also must tell you here, the power of multinational companies, because of their global volumes, so high, any rate they can give, it's a matter of taking a decision. I was surprised to see thyroid testing, that is TSH test, go cost-wise the lowest. And today doing TSH test is not profitable as much as blood sugar is. So having said that, I want to conclude my communication on the specific question you have asked. Indian players are maturing, though slowly. And as it looks like, it's a matter of another 10-15 years to see a double-digit contribution by Indian IVD players in the global market. It won't happen overnight. It is not one man's dream. It's a complete canvas needs to change. Mindset needs to be changed. Our capabilities to have a vision and work for next 10-15 years also need to be changed.
Thank you very much, Dr. Velumani, for your candid and encouraging feedback. And thank you very much to all our panelists, all your insights on India's IVD market in global context. A truly comprehensive roundup on the state of our industry, and I thank you wholeheartedly for your invaluable contributions today. I would now like to invite Mr. Abhinav Thakur, Secretary ADMI, to take the floor for the Q&A session with the audience and for sharing the top takeaways in this session. Thank you all very much once again. Abhinav, over to you.
Thank you, Veena, for the excellent moderation of the panel and getting great insights from out of the veterans of our industry who have been here. And we have certain questions that have been coming out, so we can get insights and answers to the white paper that we are planning to put up to the government. As yesterday's session, the DCGI, Dr. Somani, has requested the Association of Diagnostic Manufacturers to put up a white paper so the government can work towards increasing the Atmanirbharta in the country. So certain questions that have come up that would help us in this white paper would be, one is to Mr. Vajrani and Mr. Sriram, since they are into the manufacturing of high technology products which are being imported into the country. And they have come up with manufacturing these products in the country. So as we saw, 80% of the technology is held by USA, EU, or Japan. So how can India gain the technology which is held by these countries so that there can be more manufacturing? As technology is a constraint, we have the capital, we have the skilled manpower, but where we are lacking is the technology which is held by 80% of just 3 major countries in the world. So how can we get more technology into the country?
May I start?
Yes, yes, please.
Yeah. Well, that brings us to the question of the R&D. We are still discussing about Make in India, but along with it, we have to also discuss how to develop in India. The R&D remains a key. Of course, first stage, we must make in India, gain the volumes, gain some muscles, gain some money, so that we can invest in R&D, because that's absolutely essential. If you don't have technology, you remain more like a labor contractor, or you make only the old products which have already seen their life. So that's very important. Of course, in many countries, the government is very proactive in helping developing technology. I remember about 10 years back, China started a scheme. They asked for applications for companies to develop the chemiluminescence. So they realized that chemiluminescence is the future. And they shortlisted 30 companies who applied for it. And each of those companies got about between $5 and $10 million to develop that. Of course, like in India, China also has own, players who take the money and don't do. But in spite of that, now we have at least 6 or 7 serious manufacturers of chemiluminescence in India. And we have seen they are slowly taking the global market. So this kind of a very focused government approach, you select the product, or the technology, and invite the companies, help them do it. And that can really create the future. Don't know, India government has many other things to do. So we don't know when that will happen, but it's important that the industry itself spends. Today, South Asia is spending 15% of its revenue on R&D. We feel that if we really want to be, remain a player in this market, so 15% of our revenue goes directly to R&D. So that's a must. But that requires that, its own commitment to R&D and the government's support, which of course can give a big boost to it.
Great. Thank you. You're on mute.
Sorry for that. Yeah, I completely agree with Suresh that the only way you can get technology is if you're going to invest in the technology. So R&D is a very key component. It was said earlier, I think Dr. Velumani said this, that most of the Indian companies are happy to just repackage or just do very minimal kind of manufacturing and not focusing too much on trying to acquire and develop technologies themselves. Now, as far as technology is concerned, you can of course have an R&D and develop a new technology, or you can even reverse engineer technologies. It's not very difficult to do that. And at the same time, you can also have industry academia partnerships, which can also drive that. So it's a question of trying to have the will first to do something. Get technology. You can even acquire technologies from abroad. I mean, you don't have to do everything here. That's also a possibility. So I think multiple methods are available. I think it's only a question of the will to do it. And of course, funding is an important part of it. And today, government is doing a small amount of funding, which is not really enough for developing technologies, but at least to do some startup work. But at the same time, you're also able to get funding from other sources nowadays. It's not that difficult to get funding. There are many funding agencies which are there, which are looking at healthcare as a major segment. And medical devices especially. They're all willing to put money into some good projects. So that's another way to do it. And I think at some point of time, we should stop thinking about the government doing everything. I think that's not going to happen. Yeah. In India, the government is already under a lot of pressure and the priorities are so wide. With limited resources, they have to do so many things. So it's not possible to expect that they're going to put a lot of money into IVD technology or IVD, helping IVD manufacturers per se. So I think the industry must understand that, we have to put our own stake also, not depend too much on the government for doing all those things. And there are multiple ways you can get technology into the country. You can develop it yourself, you can reverse engineer, you can acquire. There's so many ways it can be done.
Great, thank you. So my next question is to Dr. Muni. As we have heard in the panel today that the non-COVID testing has come down and patients are afraid to visit the labs or the hospitals because of they don't want to pick up infections. They're afraid of picking up infections. So what is the solution going forward to get back the confidence in the patients to come back and start visiting the hospitals and the labs, as COVID is here to stay for at least the short term?
Hello.
Yes.
Yeah. I think Veena asked a question, is it a 100-meter dash or it is a marathon? It is already 3 kilometers over. So we don't know whether this marathon is 30 kilometers or 300 kilometers. So this is how I look at it. And I don't think we can do as a laboratory or a diagnostic player much to change the perception of the common man towards the reaching to a doctor or a hospital, which at present he is thinking is highly risky. We as a government country has created such a panic, not only to common man, it's also to doctors, nurses, and also to everyone, that even doctors are still not sitting in the cabins to practice. So it is not that you can make a customer to feel more confident before the doctor feels confident. So it's something which completely, a good system is completely broken down. And the way in which the man was going to the laboratory, will he go in the same way? Or will he only call for a home collection? All these things are very, very uncertain. Whether he will visit a doctor physically or will he be very happy to contact him on telecommunication, that also is not very clear. So we still don't know much about COVID, if it is over or not. Once it is over, then only the confidence building can take place. But having said that, I believe from today, some of the governments have relaxed some of the lockdown norms. I believe by another 1 month period, the lockdown norms will come down. Movement will be easier. Movement will not be questioned And common man is worried about some police stopping him and questioning him and fining him. So a lot of things, it is not overnight a change will be there. But having said that, the healthcare was a homogeneous one identity till COVID came. Be it hospital, doctor, or a lab, it will be dual identity going forward. One is COVID, another is non-COVID. It is as simple as male toilet and a female toilet. A man who has an infection will not be admitted in a hospital which is treating for lifestyle. And a man who has a lifestyle problem will not go to the COVID hospital. There will be two different color boards soon in the marketplace. So will be a doctor. In fact, so will be a laboratory. So this is such a contrasting, and the fear has created such a big trauma. It is likely to get segregated. And the players who actually, if you see, all those IVD players are not making PCR kits for swab testing. All those who are making swab testing kits are not doing immunoassays for thyroid or infertility. So everything, it looks like will be totally changing. And today we are back with some 65-70% of the January workload of non-COVID, which I believe by Diwali it will become 100%. But I'm pretty sure even non-COVID business will be 1.25x for Q4 of this financial year. When I say so, 1.25x compared to the similar quarter last year. So this overall year might give for the non-COVID business around 10%, if it was otherwise 15%. So your 5% is gone. That is not because, it is because there is no reason for them to seek medical solution for these kind of illnesses. What is surprising? There is no increased death burden for the country, which says non-COVID consultations are less, medical solutions sought are less, but death also is less. It's a very, very worrying situation where doctors were not working and the deaths have come down. So let us look at the true statistics which will emerge by the end of the year. But in my personal opinion, we must have lost 5% year over year when we touch 31st March 2021.
Okay, thank you. A follow-up question on that. So, do you? There's a trend that we could see that there's more demand for self-testing, as the patients are afraid to go to the labs and hospitals. So, for example, in Western countries, we are seeing COVID tests for self-testing at home, and also cholesterol test and HbA1c tests, which are being in the US, are being done at home. So, do you see this trend coming up, and manufacturers can look at this trend becoming a permanent trend coming in the future?
Yeah, actually, the point of care testing is not today's market. It has been there for the last 20 years. More point of care testing in Western countries than in India, because the cost of testing in the laboratory is very costly in Western world than in India. If there is a market where for getting a blood sugar done, you have to pay $20. And if your POCT is only $1 or $2, that market will grow. But in a country like India, for $1, the man will come to your home and pick up the sample and do the test and come back and give you the report also. So less likely POCTs will be finding a huge growth in the Indian market. Again, the per capita income plays a very big role. And the laboratories are very, very cheap compared to many of the Western countries. So if you ask me, that market will be there, but that market will only grow with the total market size. It won't outgrow growth-wise the laboratory market. This is my perception. Maybe I'm wrong.
Thank you for your insights. My next question is to Dr. Kamini Walia. As you have seen, the essential drug list has been successful in India and has been implemented widely. Will we see the EDL also getting implemented pretty soon as the essential drug list has been implemented? Is Dr. Kamini Walia?
Abhinav, Dr.
Okay.
Kamini already answered this question. Is she still there? She said taking place in a phasic manner, and how in one of the states, 4 to 6 lakhs tests have already been conducted. This will be implemented in a phasic manner. That's what she told us. And there are plans to step that up.
Great. Question is to Mr. Rajesh Daga. We have seen that Roche has set up a large manufacturing facility in China. What will it take for Roche to set up a similar facility in India for not only the Indian market, but also for exports to the Southeast Asian countries?
Abhinav, Rajesh had to leave for another meeting, so we have to skip that question.
Okay, so we have the last question that will summarize our discussion for today. So this will go to Mr. Vajrani. So India's pharmacy to the world, as we know, India's the pharmaceutical industry has a revenue of $38 billion, and it is the third largest in the world by volume and 11th largest by value. So if our pharmaceutical industry has done extremely well, what will it take for the diagnostic industry to come up to that kind of performance?
Well, potentially, there's a huge potential because, as I said, India is a big country, so India will have a huge market. But once we are able to make in India and also develop the technology here, that opens up the global market for us. So global market, which is now about $70 billion, in 5 years will probably about $80-85 billion. So that's open to India. Even if you get 3-4% of that global market, imagine what a big boost local manufacturing can be. So it will be practical to get $2-3 billion in India in IVD. It's about double of today. That's the least I would say.
Right. So with that, I'd like to conclude since we're running out of time, and we have got some wonderful insights from all the veterans in the industry, and we'll definitely take this forward and include it in our white paper that we'll put it up for recommendations. And with that, our key insights for the Indian diagnostic manufacturing industry has been, as coming from Mr. Vajrani, 50% of diabetics in India are undiagnosed. So huge awareness is required for testing the undiagnosed diabetics, and healthcare is as important as defense to the nation. Another great insight is that 15% of his expenses are in R&D. So that's what will lead to innovation and technology being developed in India. Dr. Kamini Walia has told us that 90 to 95% of the EDL list has already been adopted by the Free Diagnostics Initiative. And if this initiative is taken up in other states, as it has done in Assam, it will definitely give a boost to the diagnostic industry and to the healthcare in the country. Mr. Sriram has given excellent inputs on how innovation can be done only by building an ecosystem, and ADMI can play a significant role in helping to build this ecosystem with all the stakeholders. Mr. Rajesh Daga has given us inputs that India is one of the most price competitive industries in the IVD sector, and the main factor is the out-of-pocket spending. So if we can get more public healthcare into the system, definitely develop as a larger industry. Dr. Marco has highlighted that the regulations is a good way forward since it will harmonize the Indian manufacturers with the global regulations to help us in exports. And Dr. Velmuni, as he said, incentives need to be there, infrastructure needs to be there to help the local manufacturers gain. And most important, the government should purchase from local manufacturers so that will boost to the local. Our esteemed panel, Dr. Vipul Agarwal, Dr. Kamini Walia, Dr. Marco, Mr. Suresh Vajrani, Dr. Velmuni, Mr. Rajesh Daga, Mr. Sriram, and last but not least, Mrs. Veena Kohli for holding this webinar. Thank you all for giving inputs of making India the IVD hub of the world, as we are already the pharmacy to the world. You've given us insights and inputs to make our white paper so that we can put it forward to the government to take ahead the actions that are required to grow the industry. With that, without further ado, I would like to thank you all, and we can close the session. Thank you.
Thank you very much once again, all eminent panelists. Jai Hind from our side.